Welcome to a deep dive into the world of medicine and its impact on society. We've got these lecture slides to unpack, covering everything from the history of healing to the future of medicine.
Yeah, it's going to be quite a journey. And by going through these slides, you'll hopefully gain some valuable insights into how medicine shapes our world and how it can empower you on your own health journey.
Okay, so slide one, it jumps right in and emphasizes that it's about practical application, right? Going beyond just knowing the terms, but understanding the different branches of medicine, understanding the power of preventative care, being able to differentiate between various treatment approaches.
Yeah, it's about connecting the dots, really.
Yeah.
So, for instance, understanding preventative medicine, it isn't just about staying healthy. It's also linked to, broader societal benefits like potentially reducing healthcare costs in the long run.
Absolutely. And that leads perfectly into slide two, which takes us on this whirlwind tour through the history of healing, talking ancient civilizations, herbal remedies, early surgical techniques.
Can you imagine
I can't even imagine.
having surgery back then with what they knew then?
With those tools, no.
It's mind-boggling to consider how far we've come. And it's interesting to note that progress, well, it wasn't always a straight line. The Middle Ages, for example. The prevailing religious beliefs of the time, while well-intentioned, they sometimes inadvertently hindered scientific progress, particularly in areas like anatomy.
That's such an interesting point to bring up. It really highlights how external factors they can influence the trajectory of medical advancements. And I think it makes you appreciate the rapid acceleration of knowledge during the Renaissance even more, because the renewed emphasis on scientific inquiry during that era, it paved the way for those groundbreaking discoveries in anatomy and physiology, fundamentally shifting our understanding of the human body.
And then we hit the 19th century. Talk
Yeah.
about a game changer. The introduction of germ theory, anesthesia, and vaccination, those are absolute game changers.
I know, right?
Yeah.
Like, it's hard to fathom, really, undergoing surgery without anesthesia, or even just the sheer number of lives that were lost to infectious diseases before we had vaccines. Like, these breakthroughs weren't just discoveries, they were revolutions that continue to have such a profound impact on global health today.
They truly were. Now let's delve into the diverse world of medical specialties. Slides 3 and 4, they highlight this nicely. Each branch, it requires such a unique set of skills and a deep well of knowledge.
Yeah.
We have internal medicine, focusing on, diagnosis and treatment of internal conditions. Then there's surgery, which, that utilizes operative techniques.
Yeah.
Pediatrics, obviously dedicated to the care of children. Obstetrics and gynecology, specializing in women's health. And then radiology, employing imaging technology for diagnosis.
It's incredible how specialized each of those branches has become.
Right.
And speaking of specialization, slide 4 kind of gives us this little glimpse into the rigorous and demanding path of becoming a doctor. And it's not just about acing your exams, right? It's about this deep-seated commitment to lifelong learning and patient care.
It's a long and demanding journey. After completing a 4-year undergraduate degree, aspiring physicians, they then dedicate another 4 years to medical school. Like they are just immersing themselves in the intricacies of the human body, honing their clinical skills.
And even after all of that, they're still not quite ready to practice independently.
Right.
Then they embark on a residency program, which, depending on the specialty, can range from 3 to 7 years.
Wow.
Talk about dedication. It really highlights the level of expertise and commitment that is required to become a licensed physician.
Absolutely. And while we're on the subject of, taking charge of your health, slide 5, it transitions us nicely to the importance of preventative medicine. And this slide focuses on empowering you, the listener, to be an active participant in your own healthcare journey.
I love that, because knowledge is power, right?
Exactly.
And this slide, it outlines 5 key benefits of preventative care. So first and foremost, it can significantly reduce your risk of developing certain diseases in the first place.
Right.
And if a disease does develop, early detection often leads to more effective treatment options.
Early intervention is key.
Yes.
And speaking of keys, preventative medicine really holds the key to potentially lowering healthcare costs for both individuals and for society as a whole.
Absolutely.
By focusing on prevention, we can often avoid the need for more costly and more invasive medical interventions down the line.
Exactly. It's about being proactive, right? Rather
Yeah.
than reactive when it comes to your health.
It's about shifting from that fix-it-when-it's-broken approach to a let's keep it running smoothly mentality.
I like that analogy.
Right.
And speaking of running smoothly, preventative medicine also emphasizes patient education. Like it's about empowering you to make informed decisions about your health in partnership with your healthcare provider.
Yeah, it's about fostering a collaborative approach to healthcare where, patients and providers, they work together to achieve the best possible outcomes.
And speaking of outcomes, let's transition to a critical aspect of medicine that significantly impacts those outcomes, often in ways that we might not even realize: the ethical considerations. And slide 6, this is what it gets into.
Yeah. Ethical considerations.
Yeah.
They really do provide the compass guiding, responsible and ethical medical practices.
Absolutely. And while these ethical principles, they might seem straightforward at first glance, they often involve navigating scenarios, sometimes with, like, no easy answers.
That's precisely why those open dialogues about medical ethics are so crucial. And slide 6 highlights a few key considerations. We have autonomy, which centers on respecting the patient's right to make informed decisions, about their own bodies and their own healthcare.
Yeah, it's about recognizing that the patient is ultimately the expert on their own life and experiences.
Exactly. Then we have beneficence. Beneficence, it's the bedrock principle of always acting in the best interests of the patient. Sounds simple enough, right?
It does.
But in practice, determining that best interest, it can involve weighing those complex factors.
Yeah.
The potential risks, the potential benefits. It's not always clear-cut.
And that kind of ties into that next principle, non-maleficence, which essentially means do no harm. And again, while it seems pretty straightforward, medical interventions, they often come with inherent risks. And healthcare professionals must constantly be weighing those risks against the potential benefits.
It's about minimizing harm while maximizing those potential benefits,
Yeah.
which requires, careful consideration, open communication, especially with the patient.
Absolutely. And then, we have justice, ensuring equitable access to healthcare resources, regardless of an individual's background, their circumstances.
Right.
It's about striving for fairness in a system that doesn't always lend itself to easy solutions. It's a complex issue, really, with, like, far-reaching societal implications. And finally, we have confidentiality. Confidentiality, it's a cornerstone of that patient-physician relationship. Maintaining a patient's privacy, it isn't just about safeguarding their personal information, it's also about building trust. It's about ensuring that patients feel safe sharing, sensitive information with their healthcare providers.
It's about creating that space where patients feel heard, they feel respected, without fear of judgment or breaches of trust.
Exactly.
Speaking of trust, or sometimes breaches of trust, slide 7 delves into the sensitive topic of medical malpractice. It's something that, while thankfully rare, does occur, and it can have significant implications for both patients and healthcare providers.
And it's important to remember that medical malpractice goes beyond simple mistakes,
Yeah.
The slide defines it as instances where a healthcare provider's actions, or in some cases inaction, deviate from those accepted standards of care, ultimately resulting in harm to the patient. Right, and the slide even distinguishes between, medical errors, which can occur at various stages, of diagnosis or treatment, and negligence, right? Negligence implies a failure to provide the level of care that a reasonably competent medical professional, they would provide in a similar situation.
And it's also essential to distinguish those instances from intentional harm, which, thankfully, are extremely rare. But, intentional harm would involve, like, deliberate acts.
Yeah.
Such as, unethical experimentation or abuse of power.
Of course. Now, shifting gears a bit, let's talk about something we all encounter at some point: medication.
Right.
Slide 8 breaks down the important differences between over-the-counter medications, OTC medications,
Right.
versus those that require a prescription.
Yeah, so OTC medications are generally deemed safe for use without that, direct supervision by a healthcare professional.
Yeah.
And they're typically used for managing those kind of mild or temporary symptoms. Prescription medications, however, those are used to address more, severe or chronic conditions.
Yeah.
And they require a doctor's order to even obtain.
It's easy to assume that OTC medications are inherently safer just because they're more accessible, but the reality is that both OTC and prescription medications carry potential risks, side effects.
Absolutely.
Always following, those recommended dosage instructions and consulting with your doctor or pharmacist if you have any questions or concerns is absolutely essential.
I couldn't agree more. Medication safety, it's a shared responsibility.
Yes.
And slide 9, it emphasizes this point, like it underscores the critical importance of using medications responsibly, following those safety guidelines to minimize, any potential harm.
Absolutely. This slide reminds us that preventing those harmful drug interactions, ensuring that the correct dosage is being taken, minimizing the risk of adverse reactions, all of that is crucial. Those are all crucial aspects of medication safety.
It's also about empowering those patients, to advocate for themselves, understanding their medications, understanding potential side effects, asking those clarifying questions to their doctor or their pharmacist. It can significantly contribute to safer and more effective medication use.
It's about being kind of an active participant in your healthcare decisions rather than just a passive recipient.
Right, exactly.
Speaking of a broader perspective, slide 10 takes us beyond just the individual level, and it introduces the crucial work being done in the field of global health. So these initiatives, they're all about improving those health outcomes, but on a global scale, particularly in low and middle income countries where access to quality healthcare, it can be limited.
And these initiatives, they address a wide range of health challenges too, from combating infectious diseases like HIV/AIDS, tuberculosis, and malaria, to improving, maternal and child health, and then tackling the rising burden of non-communicable diseases.
It's a massive undertaking, and it often requires collaboration between governments, non-governmental organizations, NGOs, and private organizations to pool those resources and expertise.
Yeah.
Like, for instance, the Global Fund to fight AIDS, tuberculosis, and malaria, and the Gavi Alliance. Those are great examples of these organizations that are working tirelessly to make a difference in global health.
Their work is absolutely vital. But as you can imagine, addressing these global health challenges, it's rarely straightforward.
No, it's not just about providing medication or building hospitals. There are those complex factors to consider, like political instability, socioeconomic disparities, cultural barriers.
Absolutely. It's about understanding that intricate interplay of factors that influence those health outcomes, and then tailoring those interventions to specific contexts.
Right. And this leads perfectly into slides 11 and 12, because now we're shifting from a global perspective to a more individual one, and we're going to look at the future of medicine. And these slides, they give us this glimpse into a world where these cutting-edge technologies, they're poised to revolutionize healthcare as we know it.
It's definitely an exciting time to be talking about medicine, that's for sure. Like, we're really on the cusp of these breakthroughs that have the potential to, not just treat disease, but to actually predict it, prevent it, potentially even cure it in ways we could only dream of before.
It really does feel like we're stepping into an episode of a sci-fi show.
Right.
Slide 11 starts us off with artificial intelligence, AI. I mean, we're already seeing it being used, right? And to analyze those massive data sets of medical images, patient records, detecting patterns, even making diagnoses sometimes, like before human doctors can.
It's about, augmenting the capabilities of healthcare professionals,
Right.
not replacing them. Right. So, imagine an AI algorithm that analyzes thousands, tens of thousands of retinal scans, to detect those early signs of diabetic retinopathy, something that might be easily missed by the human eye.
Right.
This early detection, well, it then allows for timely intervention
Yeah.
and potentially much better outcomes for that patient.
It's like having an extra set of eyes, but way more precise.
Exactly.
And speaking of precision, we can't forget about wearable technology,
Oh, absolutely.
which is mentioned on both slide 11 and 12, from those smartwatches that we have now, tracking our heart rate, our sleep patterns, to devices that can even monitor blood sugar levels, in real time. It's giving us this unprecedented insight into our own health.
And it's empowering those patients to really take that more proactive role
Yeah.
in managing their own health. And it's also providing doctors with that more holistic and continuous stream of data, which can lead to more personalized and more effective care.
It's like the ultimate feedback loop.
Exactly.
And speaking of personalized, slide 12 dives into the game-changing potential of personalized medicine.
Yeah, this is where we move away from that one-size-fits-all approach to treatment
Right.
towards therapies that are tailored to an individual's unique genetic makeup, their lifestyle, their environmental factors. It's really incredible.
It's like having a medical plan designed specifically for you,
Right.
and then it gets even more futuristic. Or we're talking gene editing.
Yeah, gene editing, it holds the promise of actually targeting the root cause of these genetic diseases,
Yeah.
potentially offering cures where previously there were only treatments. I mean, imagine the impact this could have on conditions like cystic fibrosis or Huntington's disease.
Oh, it's incredible to think about. And lastly, we have nanotechnology, which, it just sounds like something straight out of a science fiction novel.
Right. It does, doesn't it? But it's becoming science fact. We're talking about microscopic robots delivering medications directly to disease cells, repairing damaged tissues at the molecular level, revolutionizing how we even diagnose and treat diseases.
It's mind-blowing. And all of this, from the AI to the nanotechnology, it all points towards a future where healthcare is increasingly more personalized, more proactive, and potentially even more effective.
It's a future where, we continue to learn, adapt, and innovate to address those ever-evolving healthcare needs of individuals and of populations around the world.
And that's a wrap on our deep dive into the world of medicine. I mean, we've covered so much ground, from ancient healing practices to, literally mind-boggling medical innovations that are on the horizon.
We've seen how medicine has evolved really over centuries, shaped by scientific breakthroughs, by
Mhm.
societal shifts, and, our growing understanding of the human body.
And while we've explored a lot of different facets of medicine in our deep dive, there's still so much more to discover. So as we conclude, we want to leave you with this question. How do you see all of these advancements in medicine shaping your own personal health journey in the years to come? Until next time, stay curious and keep exploring this fascinating world around us.